Hello children, I'm your teacher from grade 4. Today we are going to learn the second part of the second ENV lesson, Safety and Precaution. During this session, we are going to learn precautionary measures taken in different occupations and sports, occupations-based accidents, how to make a pincushion, types of diseases. Let's see the precautionary measures which are taken in different occupations and sports. Some laws have been made to protect the health and the safety of the people who are engaged in different jobs. People need to be safe when they are working. Therefore, wearing safety equipment is a must. Not only for occupations, but also people who do sports also need protective clothing and equipment because playing sports is a lot of fun, but getting hurt is not. Following are the equipments and protective clothing needed for safety. Technician is a specialist in the technical details of any occupation field. For example, automobile technician. They wear protective clothing such as overall, safety shoes, helmet, protective glasses, and they use safety equipment like pliers, hammer, knife, screwdrivers, and nails. Electrician. Electricians work with electric power. They install, test, and maintain wiring, lighting systems, and fixtures in homes and businesses. They wear overall, rubber slippers or safety shoes, helmet, protective glasses, and they need tester, multimeter, and bucket crane to do their job. Gardener is a person who gardens specially for pay. They wear gloves, boots, cap, and use equipment like mammoth and rake. A miner is a person who works in a mine. They use helmet, gloves, and pickaxe to mine. A doctor is a person who gives medical treatment. They wear coat, gloves, cap, and utilize stethoscope and forceps. Professional sportsmen such as motorcyclists uses helmet, jacket, and gloves. Cricketers wear a white shirt and the trouser, helmet, gloves, pads, and guards. The main equipment for the game are bat and leather ball. Swimmers wear goggles, swimsuit, and bathing cap. Occupation-based accidents. Occupational accidents are currently defined as unexpected and unintentional series of events leading to a physical injury of a person at work. Some of them are can get electrocuted, hands and legs could get caught in the machinery, harms eyesight, strains on the body, and lung diseases due to inhaling dust. Now we are going to make a pincushion. We use pincushion to secure the pins or needles, and it is easy to store as well. First, cut 2 circles with diameter of 10 centimeters and 4 centimeters out of fabric. Then sew the big circle using blanket stitch as it's shown in figure 1. Turn the circles inside out and stitch them leaving a 2-inch opening. Then turn the 2 circles to the correct side and fill it with cotton or pieces of fabric. Fix a handle in the side of the opening with a ribbon or fabric and close the opening. Insert the needle with the thread in the center of the circle and again insert the needle to the same place from the top to the bottom in the center. Then sew it like a pumpkin as shown in the picture and tie the end of the thread. Have you ever had a cold or a flu? Did it make you feeble? Yes, when we are sick, we get weak. There are two types of diseases according to their cause. They are namely contagious diseases and non-contagious diseases. When an illness is contagious, it means one person can catch it from another. By covering your mouth when you sneeze or cough, you can prevent bacteria and viruses from getting in the air. It's also important to wash your hands whether you're sick or well to prevent the spread of germs on objects that other people will touch. Some contagious sicknesses that kids get are chickenpox and measles. But sometimes we can catch contagious diseases by mosquitoes such as dengue, filaria, and malaria, or by drinking dirty water and eating spoiled food, which causes diseases like cholera, diarrhea, and dysentery. Non-contagious diseases. Diseases that are not contagious are called non-infectious or non-communicable diseases because they can't be spread from one person to another. So there is no vector for them to move from one host to another, no virus, no bacteria, no pathogen. Instead, these diseases are caused by other factors such as genetics, environment, and lifestyle behaviors. Some can be prevented while others are completely out of control. Let's take a closer look at what these diseases are and how you get them. Diabetes. By consuming food with starch and too much sugar. Gastritis. By consuming instant food, oily food, or by skipping meals. Heart diseases. By consuming oily food. Okay children, we learned about precautionary measures taken in different occupation and sports, occupation-based accidents, how to make a pincushion and types of diseases today. It is time to use your thinking caps and answer the following questions orally. First question is, what are the two types of diseases? Provide two examples. Second question, state 4 accidents that can happen when engaging in an occupation. Last question is, name 2 protective gears or clothing for the following occupation or sport. Cricketer, electrician, gardener, swimmer, doctor. That's all for today. See you soon with a new lesson. Thank you, stay safe and have a nice day.